Welcome, everyone, to Tips and Tools. Today, we're going to be looking at addiction and the family unit. I'm Dr. Carlos, behavioral psychologist, and here's my co-host.
And I'm Dr. G, clinical psychologist.
We've been looking at addiction at all different angles. We're going to continue to look at addiction from all different angles. But today, we're going to be looking at how it affects the family, the children, the parents, the siblings. So let's get started. Dr. G.
Yes, sir.
Well, welcome back. This has been a wonderful series on addiction. I love it. I really don't know how many people know as much about addiction as you do. You know a lot.
There are a lot of people who know more than I do.
So let's look at the family.
But they're not here in the studio. That's the difference.
That's right. I'm definitely not one of them. So the likelihood of children, do they have a higher propensity to become addicts?
I think they do have higher propensity to really get derailed of a lot of, if you will, healthy pathways in their lives, not just gravitate toward addiction. Certainly, that's a great possibility for children to gravitate toward addiction if their parents and family members have been addicted or still continue to be addicted, because, as you can understand, there is certain normalcy that goes along with that lifestyle that they have grown up with. So if an addict or addicted, a couple that is addicted, they create this family unit and they're really don't pay that much attention to their behaviors, to their interaction, to their teaching, to their parenting. They may send the wrong messages, more or less normalize addictive behavior. Because as you can understand, addiction is not simply about substance use. It goes way beyond that. We are talking about addiction cycle that really includes a severe level of dependence on substances or processes, such as gambling or sex addiction or other types of addiction. And so it has a very deeper psychological component to it beyond just simple, gravitation toward chemicals.
Actually, let me ask you a question on that. You bring an interesting point. You mentioned different types of addiction. I think most Americans, or most cultures actually in the world, probably think when they hear addiction, drugs.
Right.
But you bring up gambling, there's sexual addiction, anything, right? Are those addictions, how would I say, easier or give a higher propensity for the children to adopt those addictions themselves than a drug addiction? Or is a drug addiction more powerful or an easier one for the children to adopt?
I wouldn't really conceptualize this as simple as, easier or harder. Each one of them has its own complexity. I mean, each one of them can be harder than the other one if you look at it from a different angle. For instance, let's say sex addiction, because sexuality is part of human functioning. How can you really separate yourself from sex addiction, right? By abstinence? Well, then you don't have sex. You're kind of foregoing a part of your nature, right? So that could be very, very difficult.
What about like a Tiger Woods? Tiger Woods, had multiple girls.
Right.
Classified as sexual addiction, I guess.
Right.
Do the children who see that, his children, does it alter their view, not only of him, but does it alter their view and perception of sexuality? I mean, do they become sexual addicts, or easier to become sexual addicts themselves?
No, I wouldn't say that it is easier. We don't want to take like a brush, like a wide and broad brush stroke and kind of just label everything in with one word and say
that's what I do.
That's you do for what you do for a living. But we don't want to do that in psychology when it comes to, especially what we are discussing with our viewers, for them to be able to dissect this. I would stay away from these overgeneralizations or stereotypical way of thinking. Even though we may think that makes life easier, that actually doesn't make life easier. It makes it harder because we are taking a very simplistic look at a very complex phenomenon. So in other words, what we are doing is we are fooling ourselves, or we are derailing ourselves. We are kind of blinding ourselves to the complexity of the issue, and therefore we really are setting up a trap for ourselves. So rather than thinking about which one is easier or harder, what I would question is like, why is it important to know which one is easier or harder, as if we had a choice, a healthy choice. You may think so. Some of our viewers, perhaps you may be thinking, well, if I had to choose between one addiction or the other, then which one would be more healthy to choose? Which one is easier, especially as you're talking about a family unit? Maybe a parent says, well, maybe as part of their justification, right, or rationalization, well, I'm just a sex addict. I'm not addicted to substances. Therefore, my children don't smell it on me or see me, kind of behave in an uncharacteristic way because I can hide it well. It doesn't mean necessarily that the addiction is healthier, number one. Also, it doesn't mean that family members really do not notice anything. Also, it doesn't mean that the behaviors of the addicted person due to their sex addiction would not negatively impact their children or their upbringing or their parenting style down the road. None of that can be predicted with certainty. Therefore, instead of choosing, well, do I want to just, stick to my sex addiction and I'm happy that I have that instead of a substance abuse addiction, we want to really look at the underlying condition. Why am I addicted in the first place? Why can I not get over that? How will that affect my family? And is there other options? Is life, the question that I want to actually ask our viewers is, if you are struggling with addiction, where does your assumption and this certain assumption that you may have that life is not worth living or more purposeful or more meaningful without the addiction that you're struggling with? If you believe that, if I gave up on this addiction, if I healed from this addiction, life would not be as fun or exciting or wonderful. Where does that assumption come from? How do you know? And especially if you go back to asserting perhaps that, well, I know because I've been there, I've had such a life, it was boring, it was unexciting, it wasn't as fulfilling, then I would really go back to a saying that I have used and heard a lot of people use. A patient is usually, or a client, in this case I would say a patient, someone who is struggling with something, is not the expert, is not the best source of evidence to go back to. So if you're using your own thinking, your own experiences as a source, as a evidence to rely upon for kind of this prediction that, because I have had this life and it was boring, therefore I can rely heavily on it, and that's why I'm preventing it, and that's why I'm engaging in this more fun life, then what I would really question is that, well, if you knew how to live life completely, happily and healthy, in the most healthy fashion, then you wouldn't have gotten into addiction in the first place.
That's a good point.
If your thinking had not been faulty or irrational or erroneous in the first place, you wouldn't have been in this place, in this mess, in the first place. And the only argument that people can bring up is a situational or environmental or external argument. They would come up with reasons such as, well, my thinking is right, my life has been okay, it happened to me, something occurred to me, I am the victim here. Don't look at me like I had a choice and I chose addiction. No, it just happened to me. Like I was at a party and people offered it to me and I was under peer pressure. Or it happened to me because, I have had trauma in the past. I've had traumatic experiences and it was too overwhelming, so I had to numb myself to it. So I somehow drank that bottle of, whiskey to kind of drain and drown myself or my pain.
Is that common for addicts to defer responsibility? To something?
Absolutely. That is extremely common. That is the hallmark of the addiction cycle, and one of the most pronounced and profound characteristics we see in addicts to defer responsibility to others.
Is it the
and never
overwhelming
take responsibility?
Is it an overwhelming shame and guilt because if they accept responsibility of being an addict, there's an overwhelming a feeling of shame and guilt?
One could say that according to some, let's say, a certain theory. There are many theories and conceptualizations out there, ways of describing things. And one of the theories that is out there, yes, explains it from this aspect of addicts have already lived with a lot of shame and guilt for many, many years. And yet adding another level of shame and guilt, let's say in recovery, would be just unbearable to them. And they're not ready for that type of a responsibility. Another aspect you can look at is more of a cognitive approach, meaning what the mind is doing rationally. It's so, our brain is so complex and it is so, I would say, paradoxical. On the one hand, it can be genial. It can create and, invent and discover things in a very genial fashion. But on the other hand, it can fool itself easily, such as this type of rationalization that a person would tell themselves that, well, it happened to me. It's not my fault. I can never get out of this. It's not my choice. But what they're doing, a person who is telling themselves, that this is beyond my control or my will or my choice or my responsibility, they're deferring responsibility or displacing or basically, shifting responsibility to outside factors, outside resources, outside people, external people. I'm not saying that the recovery is completely under their control. And I'm not saying that's completely under the control, but as long as they don't come to terms with the fact that they have a role that they have played and continue to play, then they don't know what that role is. So it takes a certain mindset, the mindset that they need to obtain or espouse is that of I'm willing to take responsibility, even if it means 10% responsibility. They don't have to take 100% responsibility for everything, because that's also a failure. That's actually a failing proposition. It will backfire. It will overwhelm them. It will give them too much sense of, let's say, effectiveness or ability that they do not possess. And almost like a sense of false confidence that they can do anything they want, but they can't, certainly. That they could simply stop addiction by their strength of their willpower, but they can't. We know all those things. But simply shifting responsibility to everyone and everything but themselves is going to derail them from the get-go, from the very beginning of their recovery. So what they would really need to do is look, first of all, coming with a mindset of, I have some responsibility somewhere. Let's find out where it is.
That seems to be an interesting problem, because I don't want to stray too far from addiction. We don't have a lot of time, but it's interesting because it seems like society in general has a problem with that. We see that a lot in the media all the time. People admire people who take responsibility. It's my fault.
Yes.
And it's kind of funny. It's an odd phenomenon. Won't go there now, maybe another day. Does it matter if the addicted parent, for instance, we talked about my father a little bit last time. Neither my brother or I really ever had an alcohol problem. My first drink, I think, was I was 28, and I stopped by 30. So I had one drink a week, and that was about all I really liked. He used to always preach the famous adage, don't do what I do. Do what I say. And does that work a lot for certain children who don't become addicts later, because the parents know their behavior is really wrong? They feel guilty. They don't want their children to do it, but they don't have either the coping skills, the resilience to stop themselves. Is it effective at all? Is that one of the reasons why maybe children don't become addicts, or is it too complex?
You always got to look at these things in context. So basically, if you think about it, it worked for you, and may work for some of our viewers who have the same context, which means that we got to look back at, like, why did it work for you and your family and yourself and your brother? Maybe because you were actually the type of person who was prone to listen to the words rather than look at the actions and behavior.
Point.
Maybe was it because you simply were able to contrast the impediments, the damage that was done by the behavior of one person, but also you were comparing and contrasting this with the behavior of other significant people in your life that you valued or idealized at some point. And maybe you were able to really discern that, yeah, something doesn't make sense here. So I'd rather not follow in the footsteps in terms of the behavior. I may choose to follow in the footsteps in terms of the verbal command, the verbal message that I'm getting from this person, the wisdom. Maybe you looked at it as, well, they have tried it and they know better because they've tried it. They know it's not working, so they're telling me it's not working. So why should I put myself as more or less the guinea pig? They have been the guinea pig, so I'm happy, I'm lucky that I don't have to be the guinea pig. They have experimented with it, so I don't have to experiment with it anymore, right? So you see, because the human psyche is so complex, and we don't have like an X-ray machine to see all your, past history of 20 plus years. Right? And,
Nice man.
right,
I was going to ask me for money later, but go ahead.
all your memories, all the events that you have experienced, we can only infer, we can only hypothesize that about that complexity. We could simply sit down and after hours and hours and hours of, let's say, talk on and maybe psychoanalysis and analyzing certain your past and upbringing and behavior with your collaboration and cooperation, where you are a collaborator in this, figure out where it goes back to, like, oh, okay, now we know after hours of analysis, okay, it had to do with some kind of message you received, or it was more your propensity to listen to his words rather than watch his behavior. So we can't say it with certainty, but what we could do, because I don't want to be just too general and theoretical here, and definitely share with our viewers some, let's say, tips and tools as the label of our show indicates. The notion of a family unit in the upbringing of children is of paramount importance. And parents are role models. Parents are guides. Parents are teachers. Parents are protectors. Parents are, people who really also are liaisons, if you will, between the children and the world. If you as a parent, again, if you're in the role of a parent, can look at that a little bit differently and see if it is worth to kick that addiction for the sake of both your own health as well as the health of your children, then why not? I really want to take that approach today, examining your belief system. Where do your assumptions come from? The certainty that you have.
Describe a little bit about assumptions.
Well, we make a lot of assumptions in terms of, let's say, a father or a mother may say, they will never notice. That's an assumption. What's going on with me. Oh, they better get to know it early rather than late, right? From their own parents, like what it does to what addiction or substance use or whatever it does to a person. Or they're smart enough. Any types of assumptions, these are assumptions we make without having a valid evidence as to, is it true in this case or not?
So an addict might say something like, well, church won't work for me, or this won't work for me if they're trying to replace the addiction. So they're addicted to drugs. They may make the assumption that something won't work in replacement of it. Therapy won't work for me. Is that something, an assumption they usually make?
That is an assumption for most of the time, unless they have tried it and it didn't work. But also, they would generally, people who have tried something and it hasn't worked for them, they usually are deterred from trying it again because they're thinking that, the same thing will happen. Versus, let me bring that example. You go to a doctor, you have some, problems with your thyroid or whatnot. You go to a physician and they cannot fix it. Do you give up on all physicians? You don't. You go to another physician. You get a second opinion. You get a third opinion. You do your own research. You don't give up. And that's not what we see with addicts, right? They will easily give up. They may go to one therapist or one physician or one priest or, shaman or whoever that is. And just because it doesn't work the first time around, they would just give up. So, okay, no, it doesn't work for me. I got to go back to my addiction.
Is that, so they really, are they kind of, they're making an effort, but not really an effort? I'm just doing it for show, to show other people I made an effort, or is it?
They attempt to, as if there is magically a solution out there that is readily available and somebody could just deliver it to them. And again, it's an external point of, perspective that something has to happen to me. Like if I go to a doctor and they magically give me a prescription or magically give me a certain book or certain wisdom and then I'm healed. That's not how it happens. We have to do the work internally. We have to be willing to put up with the struggles that life is delivering to us. And we have to grow through that. And we have to learn about ourselves. We have to develop insight about what is it that is afflicting us. What is its structure? What's the organization? What's the foundation? How come this is happening? And what role do I play? You see, there's also a lot of, let's say, lack of self-confidence. Lack of confidence.
On the addict's part.
On the addict's part. They don't look at the fact that, they do have, granted that we have to certainly make sure that a person, for instance, doesn't have intellectual disability or a severe physical disability. But on average, if a person has average intellect, average ability, they have the machinery, if you will. They have a brain, they have a body, they have a mind, if you will, right? And they have social skills. All of that is the foundation to learn more about oneself. Any addict can go to a library and sit and learn more. Any addict can go to, let's say, a quiet place, find a quiet place and away from other addicts if they wanted to. Any addict can at least try to reach out to individuals that either are professionals or friends or family or acquaintances and seek help and reach out in order to ask for help, right? If we shift our attitude and our mindset from deficit to abundance, what we have instead of what we don't have, then things start shifting, things start changing.
That's dramatic too, isn't it?
It is huge. But that's why a lot of people struggle with addiction. They come out of it by themselves. How do they do that? They don't go to recovery. They don't go to treatment centers because they are self-taught, because they use the machinery in the right direction.
That's interesting, because I remember speaking to a couple other people on other shows, and one concept that I really enjoyed, and see what your thought is for addicts, is the concept a lot of times people focus on what they don't want.
Right.
And they don't focus on what they do want. Yeah, so instead of focusing, I don't want to drink anymore. I don't want to feel bad anymore. What should they focus on?
Well, what they should focus on, that's a good question, is, for instance, in the first example you gave, if instead of saying, I don't want to drink anymore, what they should focus on is, I want to have a healthy diet. So replace those moments of drinking alcohol or doing substance use with something healthy. I am going to drink an energy drink, for instance, that will give me some boost, some energy to make me feel better. Or I'm going to drink some natural juice, if you will, from something that really everybody has some kind of a preference, right? Like a preferred fruit that they like, to give themselves that, if you will, that rush of sugar, right? To feel a little bit up, elevated. I'm going to again watch my diet to eat in a healthy and joyful fashion, like really enjoy that aspect of my being, of my humanness. Eating should not be so automatic. Drinking, eating should not be that mindless, if you will, as if this is just like a trash can, or right? That we just dump anything into this garbage disposal, more or less. No, it's not a garbage disposal. What we have is a valuable organism. I am putting in my body things that should be valuable, nutritious, healthy, because I value myself. If we have that type of an attitude, so we pay attention to anything that I put in my mouth, whether it is a vitamin or a supplement or a medication or food or drinks. So that's one aspect of shifting from I shouldn't be drinking, I don't want to drink, to let me regulate that aspect of my life rather than ignore it for a while. And then the question, well, we don't want to go there because that becomes a therapy. Like, why do I drink in the first place? That would be a suggestion. But
that's another show, yeah.
That's another show.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Let me recap a little bit too, because I know we're about a little bit past halfway. Here's tip 1 for everybody: is take responsibility. We talked about that. Yes. So that's one tip.
Even if it is just 10%.
I take a little bit, right?
Just to take a little bit responsibility.
That's a great point. Take little steps, even if you can't take the whole.
Right.
And tip 2 for right now is change your focus, your perception of things, right?
Absolutely. Very good. Change toward abundance and not deficiency. Look at what you have and what is available. Just train yourself to look at, kind of shift your attention. Pay attention to what is. Look around your room and just pay attention and really remunerate. Like you got to go through a list of those. For instance, let's say in your bedroom, you go around and tell yourself, okay, there's a bed, there's a mattress, there's a spring box, there's pillows, there's a cover sheet or
Can I interject
blanket
here?
Or whatnot. Sure.
For tip 3.
What else do you have in your bedroom?
Well, not that, but on tip 3 is one of the techniques I've used for some of the clients that I've worked with in the past is gratitude. And maybe one of the things I used to tell them is write one thing every day that you're grateful for 30 days.
Sure.
The first 7 to 10 days is not that big of a deal.
Right.
I'm grateful for this, I'm grateful for my children, I'm grateful for that. By the time you get to the 11th or 12th day, you start to dig a little.
Yes. There you go.
Maybe I'm grateful just because I woke up today with no pain.
Right.
Which I haven't yet been able to get to that day. But everybody has to be grateful for something. They're looking harder and harder to find things they're grateful for. Would that be helpful for them?
Absolutely. There are many different ways of labeling what you said. The way I have heard it is say your blessings, your 3 blessings every day or every night, or write up 3 blessings about you yourself. And you're right. After a while, we run out of those lists, or they become repetitive, unless we start digging deeper, which by itself is designed to change your attention, to change the way these neurotransmitters work, change the way you guide your thought patterns or thoughts that come up. Because, like you said, for instance, after 10 days, my thought that comes up would say something like, well, what else is there? There's nothing there. I've already said it. These are thoughts. But then if I suspend these negative or deficiency thoughts and then tell myself, well, let me see. Maybe there is something I haven't looked at. Maybe there is something more. What else is there that I'm not paying attention to? How about going back and reviewing things? Because again, when we go back and review, it's almost like forcing our thoughts or directing our thoughts to kind of reconsider what I have already considered. And as you can imagine, that can be very powerful because our momentary, let's say, recollection right now of my past 40 years is not going to be as accurate as I want to because it's just a momentary recollection. Maybe I'm doing it in 5 minutes, right? But reviewing 40 years, shouldn't it take really more than 5 minutes? Maybe an hour, maybe 5 hours, maybe
Most certainly.
maybe a week or two? If I really want to dig deep, then I will find certain things that I have not paid attention to that could be very significant, such as, let's say, an aspect of strength that I've always had, but never knew, never thought about, right? So if I dig deeper, if I just say my blessings, write one positive things about our accomplishments or a positive thing about myself every single day, I'm retraining my attention, my brain, my neurotransmitters, my thought patterns to dig deeper and ultimately find more of the foundation that has always been there, but I have really kind of neglected and haven't paid attention to.
Actually made an interesting point. As simple as the concept of just looking at your bed sheets.
Right.
I mean, you look at the Syrian refugee issue.
Right.
You have individuals that don't have beds, individuals that don't even have a home, that are running away from the dangers of their country. You have a lot of things to be grateful for.
We have a lot of things to be grateful for. And I think part of it is that it is difficult to imagine someone else's life. Like, yes, it's very hard for any one of us to put ourselves in somebody else's shoes, especially when you're talking about, let's say, refugees. But one thing we can do is to not really worry about, let's say, the moral message of it, and actually focus more on the practice of training our brain. The practice of what I mentioned to you is if we look around the room that we are in, and just for instance, look at a mirror and tell myself, well, I have a mirror in my room, on my wall. Over time, the more I look at things that are there, the more I'm training my brain on a cellular level to take advantage of the items that I do possess. Now, how does that help? If I am training my brain to become better at it, and it gets used to it, next time around, when I'm out there in a certain precarious situation, let's say I'm going to interview at a company for a job, rather than worrying too much about what I'm missing compared to other applicants, my brain is used to looking at what is there. So for instance, I may just kind of go to the restroom and look at my jacket. So, wow. Oh, or my tie. Or my shirt. Maybe there is a spot on my shirt that I haven't paid attention to. And I can clean that up. Because I have trained my brain to look differently at things. Or, again, even the spot would be probably a notion of deficiency. Let's look at what is there. Maybe I have a nice suit on and it is presentable. Maybe I feel good that day. Maybe I have a good skin tone, and so forth and so on. Maybe my eye contact is vibrant and lively and strong. So if I can look at those things, if I have trained my brain to look at what I have, then naturally I would have a different predisposition or propensity to ace that interview when I'm sitting in front of a person.
Absolutely. Let me bring it back now to the family, because we have a few minutes left, and
Yes.
I want to see if we can use those three tips that we talked about: taking responsibility, change your focus, gratitude,
Okay.
looking at things differently. How can family members, can they help each other indirectly? In other words, a child, maybe who's a 15-year-old who's watching it, or a mom or a dad who's watching it, maybe their partner is the addict themselves, the addict. Is there anything they can do here with those three tips to be able to improve the family unit or get them closer to help?
Well, yeah, I would say, first of all, families are inherently equipped with a level of caring that is unparalleled amongst friends and co-workers and acquaintances and people who don't know each other. So that level of caring, if you combine that with a little bit of a, if you will, more informed way of dealing with the things that are in front of them, then it can help them gain some confidence and renewed hope that there is an outcome to this. We just have to, continue. We can't give up. We will continue. We will change our focus. We will be more positive, say the blessings or the things that we are proud of. Train ourselves, train our mind to look at things differently from a more possible perspective. Solution is out there if we just simply get the right information that is available to us. Now, if our viewers, our clients, are people who are in doubt, perhaps, and thinking, well, my family member has tried over and over again and it hasn't worked, they have failed again. Don't rely on that. Just try something else. That's right. That's just going to take you down. That type of a negativistic, hopeless view is only going to derail you. Instead of, what you need to do is say, you know what, I have tried many things, but maybe there is something I haven't tried. Let me reach out to someone, somewhere, and ask for more information, ask for help. Share my story with them, with my family member, and see if there is anything that can be done about this type of a situation that I haven't heard before. A lot of times, this type of doubt, I would say, doubt is not always good, but sometimes it is good. If things that you have tried over and over again have not worked, then have some doubt. Maybe I haven't tried the right thing. I doubt that I have tried everything. So let me use that as a virtue, as a tool to change my next steps.
It's interesting you mentioned that, because I was doing a lot of interviews with world-class athletes, championship boxers, Olympic stars, baseball players, and one of the questions that I asked to explore their mind, unbeknownst to them, was, what did you do when you failed at something, or something didn't turn out the way you wanted it to? And they did exactly what you said. What they did is they didn't even think about the option of not being able to get to their goal, and never even crossed their mind. So if their outcome was to win, whatever it may be, all they did was change strategies constantly. If that didn't work, this was going to work. If that didn't work, why didn't it work? Can I do it again, or should I do something else? But it never came to their mind to say, forget about it, it's over.
Exactly. That's the key.
These are Olympic athletes, championship boxers, movie stars. I mean, a gamut that I've interviewed before, and it's exactly what you said. It's exactly what you said.
Fantastic.
He's reading their minds. Excellent. So this is something now. So for the family, the mother and father. So let's say the father's the addict, just to make things simple right now. The father's an addict, he's got an alcohol problem. The mother, and we have 2 children. We'll just do the standard, traditional standard family. 12-year-old, 15-year-old. The dad's got an alcohol problem, been married for 15 years. What can they do? Does the wife start changing her focus to get herself stronger? Does she help the children change their focus of the scenario, and obviously try to help the father as well? Is that something that's effective too?
Absolutely. And what I would suggest is to seek professional help as early as possible, including what is available for family members of people who are addicted, otherwise known as Al-Anon. I call them because anonymous groups that are designed for family members. So rather than AA group or NA for Narcotic Anonymous or CA or MA, there are lots of abbreviations that are basically anonymous groups that are struggling with one type or another substance. But those are for the addicts themselves. There's always these supplemental support groups for the family members, such as, Nar-Anon or Al-Anon and so forth. They have their own abbreviations. But instead of going with these abbreviations, you could just Google support group for family members of addicts. And then you will get a list of whatever substance they're dealing with. If you know, for instance, your family member is dealing with marijuana, they're addicted to marijuana. So you search for that support group for family members of addicts struggling with marijuana or something like that. But as soon as you start typing in Google, it actually gives you some ideas. So seek professional support and help immediately. That would be number one. And the reason behind that is, again, there is a ton of information, a wealth of information that is out there that you don't have. It's not available to you. You haven't been there. You have not done it. You have not studied this. You haven't experimented with that. You have not gotten degrees into this, in this field. There's so many good reasons why you don't know what you should know. So as simple as that. There's no shame, guilt. There's nothing associated, shouldn't be associated with it. There is absolutely no shame in admitting that, there's something happening to me by chance or to my, family member by choice or chance or whatever impact we want to come up with. But I have never been exposed to this. I have never been trained in this. I have never learned about this. But it's not too late. I can now go and start learning about this and be helpful. If there is caring, then there is a way. And family members are caring people, so there's always a way. Absolutely. All they need is just reach out, start a group, start attending a group, and then build upon that. Whatever they're learning in those groups, it can be helpful to them. They can build upon that. They go first for a few weeks, and then if that doesn't work, you go to another group, find another group. There's always this phenomenon called client-therapist match or personality match, if you will. You may go to one group and not like the personality of the group facilitator or group members. Well, you try another group.
Absolutely.
To see if you like them.
And even the 3 blessings that we mentioned earlier, you mentioned the 3 blessings, the gratitude. That's something that the people can do who are not the addict, who are living with an addict.
Yes.
That can help them build a resilience, more confidence. That helps them as well, right?
It helps them, and also I think it would help the family member to remember the strong, positive, constructive, healthy sides of their family member who is struggling with addiction.
That's a good point.
For instance, a family member can say, I love my son. He is an intelligent person. He has been an athlete in the past. He has been an independent thinker. He's a great guy. He has a great heart. He cares about people, everything. So at the more they're repeating this, they have the purpose and reason for continuing through this struggle. And you should do that.
Absolutely. Well, you got some great tips. And let me recap again for the 3rd time, I think, or 4th. People don't forget these tips. Tip number 1, Dr. G mentioned, seek professional support first. Whether it's a psychologist, rehab clinic, support groups for people who have a family member who's going through addiction. I myself went through Al-Anon for a while. Wonderful program. Tip 2, take responsibility.
Yes.
Which is a tough one, but something you have to do. You can take it in small steps as well. Tip 3, change your focus. Don't look at things you don't want. Look for things you do want. What do you want your life to be like? What kind of behaviors do you want to do? And then 4, 3 blessings or the gratitude exercise.
Absolutely. Fantastic.
I think it was a great hour. We kind of veered a little bit away from the family unit, but we brought it right back to you guys. We got a little philosophical. We gave you a lot of tips and tools for people who are addicts. Dr. G, any final words?
Take care of yourselves. It's a life worth living. Even if things haven't worked in the past, you have the opportunity, you deserve, and you have the options to change your future. The past should not determine your future. Past is gone. As far as time is concerned, we cannot bring it back. And those memories, we have to just deal with them and live with them, accept them. The main thing is to focus on today, which is more or less the past of your future. If you want to change the past of your tomorrow, the past of a year from now, the past of 10 years from now, remember that you're capable of doing that by changing today. Focus on changing and living a better life today.
Wonderful. Thank you, Dr. G.
You're welcome. Thank you, Dr. Carlos.
Thank you. Thank you, everyone, for joining us. We appreciate your time. I hope you learned a lot, tips and tools. We'll catch you next time.